about viral illnesses versus bacterial illnesses. As a parent, what should I know about the differences?
It can be really hard to tell the difference between the two. Some examples of bacterial infections are things like strep throat, or a urinary tract infection, or bacterial pneumonia. But viral infections can cause the common cold, the flu, influenza, or viral pneumonia. So sometimes it's really hard to distinguish the two. Antibiotics only treat bacterial infections. They don't treat viruses. When we take antibiotics we don't need, the bacteria then build resistance and the antibiotics no longer work against them. This doesn't just affect the person who's taking the antibiotics, it affects everyone in the community. If my neighbor's taking inappropriate antibiotics, I might pick up his antibiotic-resistant bacteria. So doctors have taken this issue really seriously, and as a result, almost no one prescribes antibiotics without a really good case. Viral infections really need to run their course. For most of them, there are not medicines that make them go away any faster. In short, it's impossible for most people to determine whether a child has a bacterial infection or a viral infection. The best way to tell is to have your doctor examine your child and to talk about the history. Those two things combined will lead us down a road where we can make a good diagnosis.
Whether the infection is viral or bacterial, there are some signs you should look out for. For example, any fever in a child under 2 months of age, or fever that persists longer than 3 days, or fever that does not respond to the appropriate dose of an antipyretic such as Tylenol or Motrin. Also look out for labored breathing, or a rash, specifically a petechial rash, that looks like red little dots on the skin that do not blanch or disappear when you press on them, as if you dotted your child with a red felt tip pen. These would be concerning, and you should seek medical attention for them. In some cases, we do become more concerned when an infection is bacterial. But remember, many of the vaccines your child receives in the first couple years of life protect against these very serious infections.
Something almost as painful as watching your little one have the flu is watching them melt down at the thought of a vaccination. You want to be the one to tell your child that they're going to need vaccines, that they're going to be getting shots. Don't leave it up to the nurse or the doctor, because this will likely lead to a huge meltdown and also a mistrust of doctors. So you want to be the one to tell them, and you want to tell them how many vaccines they're going to get, the location where they're going to be getting them, and at what point in the visit. Is it going to be early in the visit or toward the end? The more information you can give them, the more that they know what to expect, the better off they'll be. But you only want to give them 1 day notice because you don't want them to dwell on it. You don't want to feed into the drama. If they're freaking out, you want to stay calm. The calmer you are, the easier it's going to be for them to manage their own reaction. And remember, how you handle the situation will greatly determine how they handle the situation. So be confident, be brave, and try to be as relaxed as possible, because that will be the best thing for your child.
Still have questions about illnesses and vaccines? Get up-to-date answers at ParentsAsk.com, because raising kids raises questions.